Hello, and welcome to the Health Bulletin podcast, where we decode the science, unpack the headlines, and explore the past to better understand our future. I'm glad you're here. So, imagine this. You're scrolling through your feed, sipping your morning coffee, and you stumble upon this headline, the deadliest pandemics in history. Suddenly you pause. You think about COVID-19, of course. But what about the ones before that? What about the pandemics? That changed the course of human history, but no one talks about anymore. Well, that's what we're diving into today. Because the truth is, our world has always been shaped by pandemics. Long before the word lockdown entered our vocabulary, entire civilizations were brought to their knees by invisible enemies. How do we even know how deadly these pandemics were? Turns out, it's not that easy. See, in many cases, we don't have reliable records. As there is no hospital records, no death certificates, no case trackers, or no dashboards, what we have today. So researchers had to get creative. They looked at things like land use, tax records, even ancient graveyards. They compared how populations rose and fell over time. They pieced together stories from archaeological clues, genetic data, and in some cases, educated guesses backed by modelling. And the result? A chilling historical map that reveals just how devastating pandemics have been. Let's rewind the clock. Back in the 1300s, the infamous Black Death swept through Europe, and killing up to 60% of the population. We're talking 50 million people gone in just a span of 6 years. And that's just data of Europe. Imagine what could be the global toll. What caused it? A bacterium, Yersinia pestis, carried by fleas on rats. People didn't know about germs back then. They didn't know how it spread. So they couldn't fight it. Not really. And get this. There were 3 major plague pandemics in human history, starting as far back as the 6th century. The symptoms? Buboes, painful swollen lymph nodes, fevers, vomiting, internal bleeding. Terrifying stuff. But even that's not the most devastating event. Between 1492 and 1600, something called the Columbian Exchange occurred, where diseases like smallpox, measles, and influenza crossed continents with European explorers. The result? An estimated 48 million indigenous people died in the Americas alone. That's about 90% of the population. Wiped out. The irony? This wasn't a deliberate pandemic. It was unintended, but deadly all the same. Fast forward a few hundred years, and we enter the age of cholera. Not once, not twice, but 7 major cholera pandemics hit the world in just 2 centuries. Places like India saw millions of deaths. And yet again, no vaccines. No antibiotics back then. Just devastation. And then came influenza. Of course, the 1918 Spanish flu is the one everyone remembers. It killed up to 100 million people globally, more than both world wars combined. And it hit fast, spreading in waves over just 2 years. But there were others too. The Russian flu of 1889, the Asian flu in 1957, the Hong Kong flu in 1968, and swine flu in 2009. Each one left its mark. Each one reshaped how we live, travel, and trust science. Now, let's talk about something closer to our time, HIV/AIDS. When it first emerged in the 1980s, it was a death sentence. But science turned the tide. Antiretroviral therapy changed everything. Over the past 2 decades, millions of lives have been saved. But we still lose over 600,000 people every year. And then came the one we all lived through, COVID-19. As of late 2023, the estimated excess deaths from COVID-19 reached around 27 million. That includes not just direct deaths from the virus, but also those caused by overwhelmed healthcare systems, economic collapse, and delayed treatment for other conditions. And even now, after 5 years, we're still counting. So here's what this all tells us. Pandemics are not once-in-a-generation events. They are a recurring feature of human history. And yes, we've come a long way. From rat plagues and guesswork to genome sequencing and real-time dashboards. But we're still vulnerable, because it's not just about having technology. It's about using it well, cooperatively, transparently, and with equity in mind. It's about public trust, timely communication, and yes, access to basic care and vaccines for everyone. The next pandemic may not look like COVID. It might be something entirely different. But history shows us one thing clearly. Pandemics will come again. And when they do, we need to be ready, not just with medicine, but with memory. Because forgetting is the biggest danger of all. Thanks for listening to this episode of Health Bulletin. If you found this meaningful, share it with someone who needs to hear it. You can stream our next episode wherever you get your podcasts. Until next time, stay informed, stay curious, and take care of each other.